Assalamu alaikum everyone. Okay, so we are starting the preparation for medicine talks. We will discuss the instruments first. Then in the next section we will discuss the important X-rays and the important ECGs and the important drugs that are commonly used in the medicine. So starting from the instruments, this is our first instrument which is known as endotracheal tube. What are its uses? It is used for general anesthesia. It is used to secure airway. It is used to give positive pressure and respiratory support. It is used for the suctioning of airways and it is used to administer advanced cardiac life support for breathing. Okay, these are the most common for medicine talks. We should know the name of the instrument, its uses, and its complications. So these are the uses: general anesthesia, secure airway, give positive pressure. It is used for suctioning of airway, and it is used to administer advanced cardiac life support for breathing. Now, what are its complications? It can cause injury to the mouth or airways. It can cause migration of tube out of trachea and leakage. When we are inserting it in the trachea, it may migrate toward the outside. So, this is the complication. The third complication is sinusitis, mucosal edema, ulceration, laryngeal injury, tracheal narrowing, plus fibrosis and tracheomalacia. These are the complications of endotracheal tube. Coming towards our next instrument, that is Foley's catheter. What are its uses? It is used for urinary retention, urinary incontinence, unconscious patients. It is used in unconscious patients for urinary, urological and gynecological procedures. When these procedures are done, Foley's catheter is inserted to collect urine. Bedbound patients, for the patients who are not mobile. Bowel surgery, irritation after TURP, hematuria, pelvic fracture. Okay, so these are the uses of the Foley's catheter. It is used in urinary retention, for urinary incontinence, for unconscious patients, for urological and gynecological procedures, for bedbound patients, for bowel surgery, for irritation after TURP, for hematuria, and for pelvic fracture. Now, what are the contraindications? The contraindication is high riding prostate. It should not be inserted in high riding prostate and it should not be inserted in case of urethral trauma. So these are the uses and contraindications of the Foley's catheter. The next instrument is lumbar puncture needle. What are its uses? It is used for the diagnosis of CNS infections. It is used for the diagnosis of subarachnoid hemorrhage. It is used for the infusion of aesthetic chemotherapy or contrast agents into spinal canal. It is used for the treatment of idiopathic intracranial hypertension. It is used for the evaluation and diagnosis of demyelinating or inflammatory CNS process. Okay, this is a lumbar puncture needle. It is inserted where in the lower lumbar region or in the CNS, and these are the following uses: for CNS infection diagnosis, for subarachnoid hemorrhage diagnosis, for infusions of anesthesia, for intracranial hyperpressure. Whenever intracranial pressure is high, this lumbar puncture needle is used and the fluid is withdrawn and the pressure is decreased. Evaluation and diagnosis of demyelinating or inflammatory CNS process. Now, what are the contraindications? It is not used in increased intracranial pressure. We cannot use it in the increased intracranial pressure because if we use it, the pressure will suddenly decrease and it can lead to complications. Okay, it is contraindicated in decreased platelet count as bleeding can occur. It is contraindicated in coagulopathy. It is contraindicated in infection of skin at puncture site. It can used in it is contraindicated in acute spinal trauma and in vertebral deformities, scoliosis or kyphosis. If these deformities or abnormalities are present, then lumbar puncture is contraindicated. Okay. Now, what are the complications? Headache can occur, post-dural puncture headache. Infection can occur and trauma to the surrounding structure. These are the most common three complications of the lumbar puncture needle. Okay, the next instrument is true cut biopsy needle. It looks like this. This is true cut biopsy needle. What are its uses? To take biopsy of liver, breast, pancreas, and lymphoma staging. Biopsy is mostly required in the cases of cancers and lymphomas. So this is a true cut biopsy needle and it is used to take biopsy of liver, breast, pancreas and lymphoma staging. What are the complications? Okay, what are the types of biopsy? Incisional biopsy, excisional biopsy, and punch biopsy. Complications of the true cut biopsy needle are abdominal or shoulder pain, sepsis, biliary peritonitis, bleeding, hematoma, and bruises. These are the complications that can occur due to the true cut biopsy needle. This is bone marrow biopsy needle. Its uses are diagnosis of hematological disorders and diagnosis of bone metabolic disorders. Okay, bone marrow biopsy needle. It is some large kind of needle and it is used in tough objects, that is bone marrow, and the uses are diagnosis of hematological disorders and diagnosis of bone metabolic disorders. The common site is posterior iliac crest. Commonly, it is used in the posterior iliac crest for the diagnosis of hematological disorders in bone marrow. Okay, this is the insulin syringe. And what are its uses? It is used to insert subcutaneous insulin administration, subcutaneous heparin administration, BCG administration, intravenous insulin in case of diabetic ketoacidosis. Okay, we can subcutaneously use this syringe. This is a type of syringe but in small size. Okay, the next is laryngoscope. This is laryngoscope. What are its uses? It is used for the suctioning for clearing of airways. It is used to instill medications into airways, and it is used to for biopsy. Biopsy can be taken for investigation purposes. What are the contraindications? There is no absolute contraindication. It is contraindicated in epiglottitis, in croup, in coagulopathies, and craniofacial traumas. This is laryngoscope as you can see in the picture. Okay, this is spine needle. This is also known as old lumbar puncture needle. It is obsolete now and is replaced by newer version of LP needle. If examiner asks you about the this spinal needle, then you can write the uses and the contraindications and the complications of lumbar puncture needle. This is the old lumbar puncture needle. The next instrument is meter dose inhaler. This is meter dose inhaler. What are its uses? It is used in asthma, in COPD, in chronic bronchitis, and in emphysema. What are its contraindicated? Is contraindicated in hypersensitivity to drug in the inhaler. The drug which is used in inhaler, if it is if hypersensitive, then it should not be used. Heart abnormalities, it is contraindicated in case of cardiovascular abnormalities. It is contraindicated in pregnancy, in breastfeeding, and in recent nasal surgery. Beclomethasone is ingester which is used in this meter dose inhaler, which is contraindicated in pregnancy. Okay. The next instrument is oropharyngeal airway or Goodell's airway. What are its uses? Its uses are airway maintenance in unconscious patients and protection of endotracheal tube from occlusion, airway suctioning facility to prevent tongue biting. What are its contraindicated? In conscious or semi-conscious patient, it is not used. It is only used in unconscious patient. Gag reflex positive patient. If you insert this and gag reflex is positive, then it should be contraindicated. Foreign body blocking the airway or any oropharyngeal growth. This instrument or this object is contraindicated when there is any blocking foreign body or oropharyngeal growth. What are its complications? If long, it can cause obstruction of larynx. If short, it can cause obstruction of airways due to tongue folding, vomiting, and laryngospasm in expressive patient, and trauma to surrounding structures. So, while objecting this instrument, you should be very careful as it can cause these complications. If long, it can cause obstruction of larynx. If short, it can cause obstruction of airways due to tongue folding, vomiting, and laryngospasm in responsive patient, and trauma to the surrounding structures. Okay, the next object is or instrument is drip set. What are its uses? It is used for the insertion of IV fluid. It is used in intravenous medicine administration. It is used in repeated blood sampling. It is quicker blood transfusion. It is used for the transfusion of blood. It is used for intravenous chemotherapy and nutritional support. What are its contraindications? Sites close to infection, veins of fractured limbs, AV fistula site, affected side of cerebrovascular accident. Affected side of cerebrovascular artery. See here. Okay, this is the tips. And the next object is dry powder inhaler or discuss some indications as contraindications as metadose inhaler. This is also a type of inhaler, and the uses and indications and contraindication are same as to this metadose inhaler. Okay, this is syringe. What are indications when rapid response is required? Dysphagia, profound vomiting, no ability for oral preparation, drug is effective after oral administration. I don't know what is this. What are the indications of this? Let's see. Okay, these are the contraindications to injection. Adjacent osteomyelitis or skin infection, bacteremia, hemarthrosis, impending schedule within 3 months joint replacement surgery, septic arthritis, joint prosthesis, osteochondral fracture, periarticular cellulitis or severe dermatitis or soft tissue infection, plaque psoriasis at the injection point, poorly controlled diabetes mellitus, uncontrolled bleeding, disorders of coagulopathy. Okay. This is nasal prong or nasal cannula. What are its indications? It is used in the low to moderate oxygen requirement, no or mild respiratory distress, long term oxygen therapy. Contraindications are poor efforts, apnea, severe hypoxia, or mouth breathing. When there is severe hypoxia, then nasal prong is not used. Then Ambubeg and the other instruments are used. The advantages are that it is less expensive, it is comfortable, and it able to talk and eat. While using this, you can talk and eat. What are disadvantages? It does not deliver high oxygen, irritation, and nasal obstruction. Flowmeter. What are its indications? It is used for the diagnosis of asthma, severity of asthma, exacerbation of asthma, monitoring of COPD, help in decision when take or stop medicine to monitor the progression of disease and treatment. This is peak flowmeter. What are its contraindications? It is contraindicated in active hemoptysis, in pneumothorax, in unstable angina, and in aneurysms. Okay, this is NG tube. What are its indication? It is used for feeding, gastric lavage and poisoning, administration of medications, aspiration of gastric contract for diagnostic purposes, prolonged ileus, enteral nutrition, UGI bleeding confirmation. Okay, what are its contraindications? Contraindication is mid-face injury, basilar skull fracture, history of gastric bypass, history of alkali or acid ingestion, esophageal structures, and coagulopathy. These are the important instruments of medicine talks. In the next section, we will discuss the important X-rays and the ECGs, and we will discuss some important topics for counseling and what are the important drugs, and also we will learn the examinations in our coming videos. Thank you.